So thank you so much, Vicky, for coming today and talking to us about your story. Um, I thought we might just start about how you first got in contact with Second Step.
Yes. So I had a diagnosis of bipolar disorder. I also can suffer with quite high anxiety as well. Um, I've suffered quite a long time with mental health, I think, from my teen years, I'd say. And I never sought support. I kind of bottled everything up. So I have had um, a long journey to recovery. I still feel what I recover. I think every day is recovery or staying well anyway. I feel that, Second Step and the North Somerset Wellbeing Service have been completely integral in my recovery. I was being treated by secondary mental health care in Weston Supermare, and that was following a bad episode of mania and psychosis that resulted in me going to hospital for 6 weeks. I was sectioned. So when I came out of hospital, I was referred to secondary mental health care, who did a great job at helping me with my recovery. And through a program called Future Steps, where you learn how to cope kind of not on your own, but back in the community away from, the mental health support that you get through the NHS. And I was introduced to Sophie from the Second Step. Found out about the groups that the North Somerset Wellbeing Service provide. So initially I wanted to join the Women's Wellbeing group on a Friday. Went and met some lovely ladies there. Had a really nice time. I think that was December 2019 I started to go there. And yeah, just felt welcomed and involved in everything that goes on in the group.
That's good to hear. And I think maybe your experience, you told me about an experience you had when you had to go out quite far away to get your crisis support. Tell us about that.
So I was becoming quite unwell with quite a bad episode of mania. I've never experienced it to that level before. I think I'd only been officially diagnosed for 4 or 5 months, so I had no idea where this was heading. I was in between services. I didn't know who to turn to. Was I meeting the criteria of the crisis team? And in the end, it got so severe, my husband had to call an ambulance and had to go to the BRI in Bristol for treatment at the A&E, which was miles away from home. I had to go in an ambulance. And, if I'd had earlier support, it might not have got to that point where I was that unwell, because a lot of it was triggered by insomnia and distress and things that they would have been able to help me with that I've learned since, like coping techniques and mindfulness and, all those mental health toolkits that you have.
I'm just wondering how you feel now that you've learned about the new safe haven service that's opened in Weston. Tell us how you feel about that.
Very pleased. It's fantastic news. I think it's long overdue in Weston-super-Mare. I think it's an area that really needed the safe haven crisis centre. Um, with the hospital closing overnight, mental health services being closed. I mentioned to you before when we've spoken that the when you suffer with mental distress, it tends to be at night or at evening times where your usual ports of call are closed, your family might be asleep or busy or working, and you need help, and you need it locally as well. It's if you don't have anywhere to go locally, you think you're not going to get any help at all. And it's so difficult to reach out when you're in crisis or you're approaching crisis. So just knowing that centre's there and there's staff there ready to help you is just such a relief, and knowing that it's there. I think it's just fantastic for everyone that will be able to use that service. And I imagine there's so many more people now following lockdown that need that help. So the timing is good as well.
Yeah, the safe haven's open 7 days a week in the evenings from 6 till midnight every night. And I remember when I mentioned it to you, you said just knowing that it was there made you feel better already, just because it's there in your back of your mind. You know that there's someone just there for you.
Yeah. I became a bit unwell the last 2 weeks. There was many warning signs that I was becoming unwell, and it was probably the worst I've probably been since that previous episode, which was a good 2 years ago now. So instantly I was scared. I think my husband was scared. We got worried because it was such a distressing experience to be that unwell. And I just had this thought in the back of my mind that Safe Haven was there now, due to open, and if things got things got out of control, if my crisis plan wasn't working for me, if I didn't get the help I needed from GP, I could phone them, you know, especially on an evening as well. Like I said, you wake up in the morning sometimes after a bad night with your mental health, and then everything's fine again. So you just go about your day, and then as you go through the day, it gets worse. And then, like you say, to have that support from, you know, in the evening up until midnight is just great. It's
Yeah.
a relief to know it's there, and I hope other people feel the same.
So
A&E is very loud and busy and distressing. You know, a safe haven says to be quiet, calm,
yeah,
supportive. You know, not a busy hospital where they're dealing with all sorts of emergencies and crises, and you know, and that's where a lot of people end up when they're approaching crisis or very unwell. And it's good to know that that might not happen for people. And
yeah,
that initial phone call is really hard, I imagine. And I've been in that place before where you need to make that initial contact, but it's the best thing that you can ever do is to make that call and ask and say that you're struggling, because
yeah,
that's when the door opens to that help and that support.
yeah. Well, thank you.